Unlocking the power of hypoxic training, how controlled oxygen deprivation boosts mitochondrial health and treats chronic conditions. Introduction. Hypoxic training, which involves reducing oxygen intake for brief periods, is emerging as a powerful tool to enhance mitochondrial function and treat chronic health conditions. Originally developed in Russia in the 1970s, intermittent hypoxic treatment, IHT, was first used to protect healthy tissues from radiation damage during cancer treatment. Over time, researchers discovered that hypoxic training offers a wide range of benefits, including improved cardiovascular health, enhanced immune response, and greater resistance to oxidative stress. Today, hypoxic training is being successfully used to treat conditions such as asthma, high blood pressure, chronic inflammation, and chronic infections, many of which are rooted in mitochondrial dysfunction. By harnessing the body's natural response to reduced oxygen levels, intermittent hypoxic treatment optimizes cellular energy production, increases carbon dioxide levels, and improves oxygen transport and metabolism. Understanding how hypoxic training influences mitochondrial health opens the door to new treatment strategies for a variety of chronic diseases. The science behind hypoxic training, how it works. Hypoxic training involves exposing the body to lower than normal oxygen levels for short periods, followed by a return to normal oxygen levels. This intermittent exposure stimulates adaptive responses that enhance mitochondrial function and cellular energy production. Key mechanisms of hypoxic training: increased carbon dioxide production. During hypoxia, the body produces more carbon dioxide, CO2, which enhances oxygen transport by shifting the oxygen-hemoglobin dissociation curve. This makes it easier for tissues to extract and utilize oxygen efficiently. Mitochondrial biogenesis. Hypoxia triggers mitochondrial biogenesis, the process by which new mitochondria are created within cells. This increases the overall number of mitochondria, enhancing the body's capacity to produce energy and improving metabolic function. Enhanced cellular efficiency. By optimizing oxygen utilization and ATP production, hypoxia increases the efficiency of cellular metabolism, reducing oxidative stress and inflammation. Activation of HIF-1 alpha, hypoxia-inducible factor 1 alpha. HIF-1 alpha is a transcription factor activated in response to low oxygen levels. It regulates genes involved in metabolism, angiogenesis, and cell survival, promoting tissue repair and mitochondrial adaptation. Hypoxia and mitochondrial health, a natural mechanism for adaptation. Intermittent hypoxia occurs naturally during embryonic development, where it plays a critical role in shaping mitochondrial quality and efficiency. Scientists now hypothesize that this mechanism can be harnessed in adulthood to control mitochondrial function and improve overall health. How hypoxia enhances mitochondrial function: improved oxygen utilization. Hypoxia trains mitochondria to function efficiently even in low oxygen environments, improving overall cellular energy production. Reduction of oxidative stress. By enhancing antioxidant defenses and reducing free radical production, hypoxia protects mitochondria from damage and dysfunction. Autophagy and mitophagy activation. Hypoxic conditions stimulate autophagy and mitophagy, processes that clear damaged or dysfunctional mitochondria, promoting the survival of healthier mitochondria. Clinical applications of hypoxic training, treating chronic conditions. Hypoxic training has shown promise in treating a variety of chronic diseases that stem from mitochondrial dysfunction. By restoring mitochondrial health, hypoxia improves overall metabolic function and enhances the body's ability to manage disease. 1. Asthma and respiratory disorders. Hypoxic training strengthens respiratory muscles, improves oxygen utilization, and reduces inflammation in the airways. It enhances lung capacity and resilience, helping asthma patients breathe more easily and reduce their dependence on medications. 2. Hypertension and cardiovascular health. Hypoxia-induced improvements in vascular function and blood flow contribute to lower blood pressure, Enhanced mitochondrial function reduces oxidative stress, a key contributor to hypertension and cardiovascular disease. 3. Chronic inflammation and autoimmune conditions. Chronic inflammation is often driven by mitochondrial dysfunction. Hypoxic training modulates immune responses, reduces inflammation, and promotes tissue repair by improving mitochondrial efficiency. 4. Chronic infections and immune resilience. Intermittent hypoxia boosts immune function by stimulating the production of immune cells and enhancing the body's natural defense mechanisms. This makes it an effective strategy for combating chronic infections and improving immune resilience. Radioprotection: how hypoxia protects healthy tissue during radiation therapy. One of the earliest applications of intermittent hypoxic treatment was its use in protecting healthy tissues during radiation therapy. Hypoxia reduces the partial pressure of oxygen in irradiated tissues, minimizing radiation-induced damage while leaving cancer cells vulnerable. Why tumors are not protected by hypoxia. Tumor tissues are already in a hypoxic state due to their rapid growth and poor vascularization. As a result, hypoxic protection does not extend to tumors, allowing radiation therapy to selectively target and destroy malignant cells. Simple strategies for hypoxic training, bringing it into daily life. Hypoxic training can be incorporated into daily routines through simple techniques that promote intermittent oxygen deprivation. 1. Breath-holding techniques. Holding your breath for brief intervals during exercise or relaxation stimulates hypoxic adaptation. This practice enhances carbon dioxide production, improving oxygen delivery and increasing mitochondrial efficiency. 2. Altitude training or hypoxic chambers. Athletes and individuals seeking enhanced performance often use altitude training or hypoxic chambers, where oxygen levels are reduced to simulate high-altitude environments. These environments mimic the benefits of hypoxic training by encouraging adaptive responses in the body. 3. Hypoxic generators with biofeedback. Advanced hypoxic generators allow for controlled administration of oxygen-depleted air. These systems use computerized biofeedback to tailor hypoxia protocols to an individual's needs, maximizing the therapeutic benefits of intermittent oxygen deprivation. The future of hypoxic therapy: new frontiers in disease management. As research into hypoxic training advances, the potential applications for disease management and prevention continue to grow. Scientists are exploring how hypoxia can be used to treat metabolic disorders, enhance cognitive function, and delay the aging process. Emerging applications of hypoxic therapy: neuroprotection and cognitive health. Hypoxia may protect neurons from degeneration and improve cognitive function in conditions such as Alzheimer's and Parkinson's disease. Metabolic syndrome and type 2 diabetes. Hypoxia promotes insulin sensitivity, regulates glucose metabolism, and reduces inflammation, offering potential benefits for managing metabolic syndrome. Cancer treatment support. Hypoxic training enhances immune surveillance, potentially slowing cancer progression and improving outcomes in cancer patients. Conclusion: hypoxic training is a powerful, science-backed approach to improving mitochondrial health, enhancing immune function, and treating chronic conditions. By stimulating adaptive responses that optimize oxygen utilization, reduce inflammation, and boost cellular energy production, intermittent hypoxia offers a natural and effective way to promote longevity and vitality. Incorporating simple hypoxic techniques, such as breath holding and controlled oxygen deprivation, into daily life can improve overall health and resilience. As research continues to uncover the vast potential of hypoxic therapy, its applications in disease management and prevention are expected to revolutionize the future of healthcare.